Are you preparing for a colonoscopy? If so, this video is for you. It's important to be informed about the procedure and understand what to expect. We're here to provide you with helpful information and education about colonoscopy, so keep watching to learn more. Colonoscopy is a common and very safe procedure that examines the lining of the lower intestinal tract called the colon, or large intestine. It is done by inserting a flexible tube, known as a colonoscope, through your anus and through the rectum. This lets your gastroenterologist view your entire large intestine and determine if there are any abnormalities. The procedure is usually well tolerated, but there may be a feeling of pressure, gassiness, bloating or cramping at various times during the procedure. Colonoscopy is an important preventive screening procedure that can detect cancer or precancerous lesions in the lining of the colon. During a colonoscopy, you can expect to have an endoscopist pass special tools through the endoscope to perform minor procedures. After your preoperative assessment has been completed, you will be taken into the procedure suite and may be asked to take a laxative, an enema or a rectal solution to clean out your digestive system. After that, the doctor or nurse carrying out the procedure will look inside your bowel and may also remove polyps, small growths, or samples for testing. You can be confident that this procedure is safe and effective as it can help prevent up to 90% of colon cancer cases. Plus, with the right preparation, it can be a successful experience. Preparing for a colonoscopy is key to getting the most accurate results and having a successful procedure. Your gastroenterologist will provide you with specific instructions about what to do in the days leading up to the procedure. This typically includes avoiding red liquids, high-fiber foods such as seeds and nuts, and a special diet on the day before the exam. In addition, you may be asked to take a bowel preparation the day before to help clean out your colon so that your doctor can get a clear view. Staying hydrated is also important throughout this time. With proper preparation, you can ensure that your colonoscopy is successful and that you can benefit from this important diagnostic tool. After the procedure, you will stay in recovery until the sedation wears off enough for you to go home. You will probably feel a bit tired or groggy even though the anesthesia takes time to wear off completely. It is recommended to take the rest of the day off from work after a colonoscopy and give yourself 24 hours to feel more comfortable. You may also experience black, tarry stools for up to 2 to 3 days after your procedure. Patient education about colonoscopy is essential so that you are aware of what to expect and how to prepare for the test ahead of time for a successful outcome. The benefits of a colonoscopy are numerous. It can help detect and diagnose gastrointestinal diseases, such as inflammatory bowel disease and colon cancer, and can help to treat and prevent them too. Furthermore, according to the United States National Polyp Study, colonoscopy can reduce the incidence and associated mortality of colorectal cancer, CRC. By taking the time to learn more about colonoscopy, patients can gain the skills and knowledge needed to actively participate in their own care. Additionally, they may also find that they are better prepared for the procedure, meaning it is more likely to be successful. While all procedures have some risk, colonoscopies are done every day and are considered safe. In fact, your chances of getting colon or colorectal cancer are significantly reduced when you have regular colonoscopies. The most common risks associated with a colonoscopy include bleeding after biopsy, tissue sample, or polyp removal, perforations, and infection. Your doctor will discuss these risks with you before the procedure and can recommend ways to minimize them. The different types of colonoscopies that can be performed include screening, diagnostic, and surveillance colonoscopies. A screening colonoscopy is typically done to look for early signs of cancer or other diseases, whereas a diagnostic colonoscopy may be done to investigate symptoms that the patient is experiencing. Surveillance colonoscopies are done to monitor for changes in the colon over time. Each of these procedures have their own advantages and disadvantages, so it's important to discuss with your healthcare provider which option is best for you. Having a colonoscopy is an effective and safe way to detect signs of colon cancer and other conditions. The advantages of this procedure include the fact that it is a minimally invasive procedure and has a markedly lower risk of perforating the colon than conventional colonoscopy. Additionally, you can be spared from sedation and the test is often able to see even small polyps. Although there are some risks associated with colonoscopy, such as inadequate bowel preparation leading to multiple clinical and economic harms, these risks are typically low when the procedure is performed by an experienced gastroenterologist. Finding the right gastroenterologist for your colonoscopy is essential. Board-certified gastroenterologists have undergone extensive training and are required to stay up to date on the latest treatments and procedures. Your gastroenterologist will be able to advise you on the best approach for your individual needs. They will be knowledgeable about any potential risks or complications associated with colonoscopy, and they can provide you with the most accurate information about the procedure. With the help of a qualified specialist, you can feel confident that your colonoscopy will be as safe and effective as possible. Aside from the preparation and procedure of colonoscopy, it is important to know that your gastroenterologist will discuss with you the risks and benefits associated with the procedure. It is also important to determine whether a colonoscopy is the most appropriate test for you and your situation. Your doctor may recommend a different test based on your symptoms, medical history, and overall health. You should also be aware that there are different types of colonoscopies, such as sigmoidoscopy, that can provide more detailed information about your condition. Finally, it is important to find an experienced and qualified gastroenterologist who can perform the procedure and answer any questions or concerns you may have. With these factors in mind, you can make an informed decision about whether or not to proceed with a colonoscopy.